Okay, so it's 2:01 now, so I think we can go ahead and get started, and then as people come in, they'll join the webinar. So welcome, my name is Michelle Fernandez. Today we're going to be talking about the impact of COVID-19 and stigma on health disparities and workforce retention. So we're fitting in a lot of different information, but you're going to see that it really all meshes together. And it's very important for us to understand these different topics, especially when it comes to how do we support our workforce, how do we make sure that they stay, and how do we make them engaged and satisfied. So before we start with everything, I just want to go through, oh, sorry, I'm having some technical difficulties. Okay, there we go. Hopefully everyone can see my slides. So we are ACU, the Association of Clinicians for the Underserved. We are workforce people. That is what we do. Our focus, and we'll see that in a moment, but the STAR Center is on recruitment and retention, but we are a transdisciplinary team, sorry. And we want to focus on access to care, clinical support, and as I mentioned, recruitment and retention. And how do we do that? It's through our resources, our training, our networking. And we also were started about a little bit over 20 years ago by National Health Service Corps alumni. So that's still very much part of who we are and what we do. Oh, sorry everyone, I'm having some trouble with the slides. Hopefully this will be the last one and then all will be good. So as I mentioned, we're also here, at least I know I'm here for the STAR Center. And this is the Solutions Training and Assistance for Recruitment and Retention. So we are part of, we're one of the National Cooperative Agreements. Oh, apologies, yes. There is some lag in the broadcasting. I know Mariah just posted that. So hopefully it's not too much of a lag. If anybody does see that, then just let us know and Mariah will be here to help you out. This is our website, chcworkforce.org. Our specialty, our area of expertise is on recruitment and retention. So what you'll see today in this webinar is that we really are focused on all of these different topics, but how it impacts the retention of our clinical workforce. So this is the awesome STAR Center team. On the line, we do have Mariah as well. So she's going to be your technical support person for anything you need. She's already kind of been working on that, helping me out at the start of the webinar. But I just want her to go ahead if she could introduce herself really quickly.
Sure. Hi, everybody. I'm Mariah Blake. I'm the program manager here at ACU. I spend most all of my time diving into the STAR Center project with Michelle and our team listed on the slide here. I'll be floating around in the background, so feel free to send me a chat or a Q&A or email me. My email's in the chat box, and I look forward to learning with you.
And then we also have Sabrina Edgington. I believe she is also on the line. If she would like to introduce herself. Mariah, I'm not sure. Oh, I'm sorry. Sabrina right now is not logged in as a panelist, so we are not going to get the moment for her to, oh, there she is. So Sabrina, could you just introduce yourself really quickly?
Hi, my name is Sabrina Edgington. I am the Director of Learning and Curriculum Design at ACU, and I'm really glad to be participating in this important session. Thank you all.
And then as it says here, I am Michelle Fernandez. I'm the Senior Training Specialist here at ACU. I've only been with ACU now for about 3 months, so I am the newest team member. I'm very excited to be talking to you about this subject matter. Actually, stigma is something that I'm very interested in. It really has been the foundation for the doctoral research that I have done. My background is in training in workforce, but also in social work. So that sort of mix of stigma, health disparities, and then bringing in the workforce component is something that I'm very passionate about. And then our last team member is Suzanne Spear. Unfortunately, she's not here today, but she is also awesome, like everyone else on the team. Okay, so we are recording this webinar, so just so that everyone is aware of that, I want you to ask questions. I'm someone that as I go through the presentation, I'm open to people asking questions throughout, so if you want to submit it on the chat or in the Q&A. Another option is I like creating a dialogue. We have to be in this virtual environment right now. But if you really want to talk, you want to ask questions, you know, have a dialogue, challenge me on something, whatever it may be, you can raise your hand. It's a symbol, kind of like if you hover your cursor over, there's a little raise hand symbol. And if you do that, Mariah can go ahead and unmute you. Of course, this is totally up to you if it's just something that you would like to do. So no pressure. At the end, there is going to be an evaluation. So we really appreciate if you could fill that out. It helps us know how we can make things better and then continue to bring you this content that is free for everyone, and we want to make sure that we continue to do that. And lastly, hopefully we can all have some fun and hopefully no more tech issues on the lab. So as I mentioned, if you want to submit questions, you can do it on the chat. So these are where the buttons are. The three dots, that's where you can go and raise your hand. If you have any questions about that, you can also ask Mariah. The one thing that would be easiest if when you send a question, if you send it to all panelists, it's only going to go to us. So if you send it to all panelists and all attendees, then everyone can see your question, which would be really great. Okay, so let's go ahead and get started and ask the question, why are we here? Well, as that very long title of this webinar suggests, we're going to be talking about stigma. But I want to talk about stigma as sort of the foundation for the conversations that we're going to have around health disparities, around COVID-19, and workforce retention, which does include our employee satisfaction and engagement. You know, we're in a whole new world, so COVID really is the context that we're in. You know, stigma is going to be the foundation for what we're going to be talking about. And then we want to show you, you know, how you can keep your workforce engaged, how to retain them in these very, very difficult times. So we're going to start with a poll. As I mentioned, I'm a social worker, so I want to check in with everyone. I want to see how everybody is doing. So just take a few moments to go ahead and answer. I know it's a little bit tongue-in-cheek with this question, but really it's just to kind of know where you stand today. I know we all probably have webinar and Zoom burnout. So just my hope is that I can sort of create this atmosphere where everyone feels engaged, welcome, and hopefully, if you're not so good, a little bit of a better day. So we'll give it a moment. And then, Mariah, are you the one who closes the poll?
Yes, I'll leave it open for just a couple more seconds so we can get some votes in, and then I'll close that and share the results out with everyone.
Perfect, thank you. Okay, that's awesome. It seems like there's a pretty even number of people that are doing good, even great. Totally understand that. It's also the middle of the week, so it's just kind of that feeling. And the last one, it's been a big year, a tough year for many, many people. So I just wanted to acknowledge that there's probably a complex number of feelings that we may be having. So now let's go ahead and get started talking about the subject matter. Okay, so I wanted to start with this idea of a new normal. The reason that I am bringing this up, showing this image that, you know, very strongly graphically represents, you know, the total cases we've had, where are the hotspots of COVID-19, the large amount of deaths, how many cases that happen per 100,000 people, is simply to say that we are all affected by this. And this is something right now that we're learning to work around. And, you know, we talked about the first phase, the second phase, but really it's almost been just sustained, and now we need to learn how to work within this new normal. Now, as many of you also know, what has happened, just like with anything huge, such as a pandemic, stigma can arise. We have burnout of our providers, not just the clinical staff, but also the frontline staff, people working in administration, leadership. You know, this is all around difficult for everyone. So as I move forward, I'm going to go first into outlining what stigma really means and why, as we live in this new normal, it's going to impact so much of what we do. So as you can see here, this is a very kind of basic definition of stigma, and that it's a phenomenon that highlights the strong power differentials that exist in society. So basically, it's people in power, and then there are the others. We sort of other a certain group of individuals. This is very much highlighted with COVID. We have seen this between the health disparities that people are facing, to just the access that some people may have, the language that we use. So stigma is very much at the root of what we're talking about. And when we look at stigma, we want to look at it in sort of three ways. So when we say stigma, a lot of people think about stereotypes, prejudice, and discrimination. But stigma does not automatically jump to that. It's not something that we automatically do. Most of us are good people. We believe we're good people, and we really feel that we don't stigmatize. But the truth is, all of us have some idea of what normal is and what is enough, like the other. So the goal here is to sort of acknowledge that within ourselves, but then also take the step back so it doesn't become stereotypes, it doesn't become prejudice, it doesn't become discrimination. And what this graphic shows is that stereotypes are really the beliefs that we build based on our own environment, what we've learned. Prejudice then becomes those attitudes that we've created from those beliefs. And finally, sort of that last step is discrimination. So that's the actual behavior that we undertake when we've really started to stigmatize a group. We're now stereotyping them, we've become prejudiced against them, and now there is discrimination. So we see this again. We see this with COVID. We see this has happened with people of different racial and ethnic backgrounds, especially those of Asian descent. We see this with providers, where people have stigmatized our clinical providers. They were very much heroes and still are for very long, but there was a tide shift that happened where people did begin to stigmatize them. So it's really important to understand that, you know, this is really amplifying these problems that we're facing as the pandemic continues to go on. Also, stigma is not simply at one level. It really is part of all aspects of society. So what I wanted to show with this image was really talking about it from the micro, meso, and macro level. A lot of times we don't think about stigma sort of in that micro level, but often what happens, and I know that has happened to me, and I'm sure it's happened to many of you, when we start hearing this constant negative narrative of people, you know, whatever it may be, like, I don't like your hair color, I don't like your body shape, I don't, you know, to more prejudice and discriminatory behaviors, eventually that sort of almost becomes our normal as well. So we start to self-stigmatize. And that's where we have this issue that we'll talk about later, where, you know, if we start to believe this narrative, it's much easier for our providers, for the people in our health centers to become burned out, to deal with depression, to deal with all of these mental health complexities that are now sort of really a huge part of our lives. They were always there, but again, now seem heightened. The second step is now the institutions and communities. This is where the prejudice and discrimination happens. So we feel it, we're part of it, it's part of who we are, we're there day in and day out. And the goal is to sort of fight against that, talk against it, and, you know, not participate in it and strongly try to advocate. And that's very much what health centers do. You know, you guys work with underserved populations, so you really are fighting against that prejudice and discrimination that many of these communities face, and you're there for your communities. And then at the macro level, it's just the inequality that happens. We have structures, policies, cultural systems that are inequitable. And that, again, has been really heightened with the structural, the systemic racism that we're seeing, which, again, has always been there. But lately, there seems to be an increase in conversation around it, which is great, because we're really acknowledging the issues that we have around this inequality that we're facing. So stigma is part of all this. And again, it's part of that root cause of it. And it impacts everyone. It's not solely the people that we serve in our health centers. It is also the providers and all staff from the top to the person sitting at the front desk who is saying hello to everyone. Everybody has an equally important role, but everybody is also struggling with all of this. Oh, okay, I thought the lag came back for a second. So why do we stigmatize? Why, you know, are people pointing out, you know, I don't want to be around these people because, you know, they're most likely to have COVID, or I'm going to, you know, refer to certain people that way, or I'm going to speak, you know, negatively of doctors and nurses, you know, as if they're spreading this, like all of those different things. Well, one of them is we fear the unknown, and the truth is there's a lot of unknowns with COVID. And that fear goes across the spectrum with everyone, not just the patients we serve, the people in the communities who may be stigmatizing those patients, but also the people in the health centers themselves. So we really need to be aware and very strongly acknowledge as best as we can our own fears so we can work within that. Misinformation, that's a huge part of it. You know, being that we're part of the health center world, really a big part of what we do is try to dispel that misinformation, but it's still out there. And it's out there very widely. It spreads very rapidly, especially with, you know, social media, all of these different things. So that is something that very quickly creates an atmosphere that says, okay, well, somebody told me this is what I believe now, so that's why I'm going to look at these other people as if something's wrong with them. One example that I can think of is sort of, you know, the issue that can come up with people who wear masks versus those who are not comfortable with masks, and the misinformation around that of sort of masks brings safety and can help us during this pandemic, but a lot of misinformation has really created this divide that is occurring. A lack of control. In a pandemic, you know, we don't have control. And the bigger something is, the harder it is for us to really understand it. We want to believe that we're in a just world, so something has to lead to that. It just can't come out of nowhere. Lack of control, humans don't do well with that. And sort of all of these three oftentimes lead to victim blaming. And again, it's that idea of like, well, I'm a good person, so if that happens to you, then maybe it could happen to me. And that's a problem because if I'm a good person, then this shouldn't happen, so maybe you did something to cause that. And again, this is sort of the foundation that we're building to understand maybe why, you know, both patients and our health center workforce are struggling. Going into the health disparities, and I've mentioned this a few times already, is I just really want you to rethink stigma, to rethink the way that we look at this, and really think about it as a fundamental contributor to health disparities. When we talk about the social determinants of health, you know, we talk a lot about a lot of different socioeconomic disparities, but we don't always talk about stigma. But stigma is an isolating factor that makes these disparities even worse. So it really should be something that we look at in conjunction with it, because it ends up having the same effect as these other social determinants. You know, think about someone who may be a migrant worker that they have to go work, and if they don't, they lose their employment. But if I test positive for COVID, I can't go to work. The people I work with are going to stigmatize me. Other people are going to stigmatize me. So do I feel comfortable going in the health center to get that test? Well, probably not. Then for the provider, that frustration that sort of comes along, that whole domino effect of, I want to be able to help my patients, but right now I'm sort of stuck within these boundaries, these societal boundaries that are coming up much stronger than we've ever seen before. And I purposely did this diagram. It looks a little bit chaotic, but it's not. And it's just who's affected. And it's essentially saying we all are affected, but there's definitely a group of people that, you know, are feeling it much stronger. So as I mentioned, racial and ethnic minorities. So this includes Asian, Pacific Islanders, especially, but you know, the health disparities that Black communities and Latinx communities are facing because of COVID. As we're talking about workforce, our medical providers, our emergency responders, the people who are essential staff, frontline workers, are absolutely affected by COVID and by stigma, and also their families, because they're connected to that. So here you have someone who, you know, someone who may be a nurse, and they're exposed to this on a daily basis. They go home, you know, there's a fear that may be passed on to their families, but other people know, well, you know, your mom or your dad is a nurse, so, you know, do you have COVID? Are you, you know, should I stay away from you? So we have to think about it from a broader systems perspective. Those who tested and even recovered, they still sort of carry that with them, that stigma, people know about it. Our vulnerable and underserved populations, which is so much of what we work with. So that is very important to also acknowledge. So thinking about homeless populations who may not have access to, you know, masks or gloves, different things that, you know, many of us sort of right now are wearing and using on a day-to-day basis. Individuals who have underlying health conditions such as coughing. I recently was on a flight and someone coughed, and everybody just had this moment of sort of this fear. And I'm sure it was just they had a dry throat, allergies, whatever it may be, but, you know, our responses are so strong at the moment. Individuals within quarantine, people who are traveling, as I mentioned, people who aren't able to telework or maybe in an environment where they are surrounded by more people that could increase the exposure. And then that ripples out, because if other people know this, they're very much going to sort of isolate and stigmatize and kind of push away out of their own fear and, you know, their own desire for safety to not be exposed to this virus. And what happens is people get excluded, they get shunned, they're denied opportunities, everything from housing, jobs, education, healthcare. Now that is a much broader sort of topic, but it does happen. You know, they may experience abuse. There's been a lot of stories about this in the news. Verbal, emotional, physical abuse, isolation and abandonment. And again, we go back to that micro level. If someone really believes in that stigma, we self-stigmatize, we may be the ones making the decision that we need to isolate. We need to step away from people, because if we don't, we're going to have a negative effect. You know, we're going to be rejected. People are going to avoid us, even whether it has happened or not. So then that has huge implications for the patients and their desire to go and get the health care that they need, because it's, you know, I don't want to know right now. I can't know. I need to sort of, you know, stay in the background because I don't want anyone to sort of shun me, take away any opportunities that I may have. And again, this also goes to people who are working in our health centers. So being able to support not just sort of the work that's in there, but the complexities of the outside life that all of these individuals are facing is very, very important for us to do. So as I move into now talking more specifically about the health center workforce, as I said, I wanted to start with this foundation of what is stigma, how does it impact health disparities? How do we look at it within this context of this new normal that we're living in? But then what is the result for our workforce? So this is just a very simple word cloud that I put together. And as you see, it really talks about mental health in many different aspects. But the ones that I really want to point out is burnout, compassion fatigue, moral distress, and the physical symptoms, headaches, insomnia, and then just sort of, you may feel frustrated because, you're doing the best that you can, you're working with your patients, you're facing barriers yourself because you're working in a healthcare environment. Your patients are facing barriers. Your family may be facing barriers simply because of the job that you do, the place that you work. So it just kind of compounds on itself. And what we really want to get to is a place that we are supporting our workforce. So rather than, for example, having compassion fatigue, finding compassion, satisfaction. The other thing that I want to say with this is when we talk about workforce, when we talk about, these results of stigma, COVID, the barriers that we face, the barriers that our patients face, that we sort of take on sometimes through different vicarious trauma, is that the fix, the solution is not one size fits all. There is no perfect solution. And many times we talk about, engage in self-care, meditate, mindfulness, all of those are key and they're so important for us to do and to promote. But there also needs to be a systemic change. So we need to understand our health centers, the culture in our health centers, and how that culture really embraces that change and embraces the concept of self-care, not just sort of putting it on the individual, but actually providing an atmosphere where it's safe for that individual to be able to take the time and the place that they need to get better. And we are going to be seeing more of this as everything kind of continues. There's been many articles on physicians who have committed suicide because of what they saw working in the ERs and in the ICUs. And already physician suicide is much higher than the general population. We want to build an environment where it's safe for people to speak up and say, I'm struggling. That's not always the case. For some people, staying silent about these feelings that then are just only going to get worse, it's because they don't have a choice. They feel they have to stay silent. There is a worry if I say that I'm struggling with my mental health, what's going to happen to my license? What's going to happen to the perception that my coworkers have about me? What's going to happen if for some reason, my patients can sense that, are they not going to trust me anymore? There's a lot of questions and fear that people ask around this. And again, part of that is they're worried that they're going to be stigmatized in their own workplace. So we want to be able to really support people so that they feel safe and they feel that they can come forward, get the help that they need, and that we're really all working together, because the truth is all of us are struggling, with this new normal, and nobody is sort of in a situation where everything's perfect, everything is great. In general, life isn't like that, but we really want to bring an empathy to everyone if we can do that. So this is our second poll question. So I just talked a lot about the stress-related reactions and everything, and I am just curious to know, since this pandemic, has it gotten worse? Is it the same? So just take a few moments to go ahead and answer, and then Mariah will let you know once she closes the poll.
All right, we'll leave this open for just a few more seconds. I see some votes still coming in.
Okay, awesome. Thank you. Okay, so definitely very much as predicted that this has made the stress-related reactions worse for the workforce. And again, I'm sure that it's all parts of the workforce, not solely the clinical workforce. And I do think that trickles out into not just the person, but also an effect on their family. You know, the patients themselves are dealing with stress reactions as well. So it's kind of like this, everything comes together. So how do we work to support our workforce in order to make sure that they have what they need as best as possible? So in going into that part of the conversation, at the STAR Center, we have core components that we talk about. You know, these are the key components that a high-functioning health center should have. Again, this is within the context of recruitment and retention. And I wanted to point out two specific ones. So building a positive culture focused on engagement, that is pivotal for us to be able to kind of, you know, overcome a lot of these stressors, lessen them, and make sure that in the aftermath of all this, that we continue to support our providers, our frontline staff, even leadership. I think, you know, it does trickle down in how we do this, but as a leader, you also have to take care of yourself so that you can take care of anybody else. And then the second one that we're going to talk about are tested recruitment and retention strategies. So that one is really, right now, we're trying a lot of new things. We're seeing what works, what helps our workforce, what is, you know, helping our health centers come through this, what is helping our patients. So in a way, we're doing a lot of testing that we don't realize necessarily all the time that we're testing on. And we're probably going to have a lot of feedback, a lot of data. So start collecting that, start keeping that sort of in your toolbox, because this is something that can be used later. Because right now, you know, it's very much a reaction to, you know, this unknown circumstance. But we can take that as a preparation as we go on. So what is a positive culture focused on engagement? The key here is that it's about two-way communication. We want to, you know, reduce burnout. We want to support these transdisciplinary teams. We want to improve their practice experience. And this is a way that not only can our workforce be engaged, they can be satisfied, but if that happens, oftentimes they will stay. So when we're thinking about retention, this is something that we need to also talk about, is that all of this stuff is connected and communication is fundamental to all of this. So what is the culture of retention in your health center or in your PCA? It has to be one that is engaged. So that just goes back to, you know, offering these opportunities to your staff to have that two-way communication. It has to be consistent. So saying one thing, doing another is really not helpful for anyone. It doesn't create and build that trust that is needed. So we really want people to feel safe and comfortable in their workplace and know that the culture that they're experiencing, what they're hearing, the support that they have is going to be consistent. And if there's a lack of that, then the changes are going to be consistent. So right now, you know, we may be offering a certain level of flexibility that wasn't available before. But if we find that this is something that's great for our workforce, you know, think about ways to really keep that going. I know in every case that may not be an option, but flexibility is important, and then having consistency. Also, a positive culture. You want to focus on what are the wins, what is the progress that we're making. So the sort of beginning half of this webinar, I talked a lot about, you know, we're in this new normal, you know, things are bad, people are struggling. there wasn't a lot of positive language that I used. But when we think about people overcoming such struggles, it is their resilience. We are resilient. They're strong. Our providers, our staff members, everybody in our workforce, they are going through something very difficult, working through something very difficult. And if we can stay positive and, focus on like, wow, you were able to do this. Look, this was the win that you had with this patient. Whatever it may be, it really can make a very positive impact on our people. And then finally, a culture of retention is also one that's transparent. This sort of goes again to this idea of consistency as well. We want to make sure that what you're putting out there, what you're saying, people understand it, and that they know what the goals are, they know how important it is, why these decisions were made, and that they feel that they really were involved. And I know not everybody can always be involved in the decision process, but that at least they knew about it. There was no blindsiding around this. And everything's moving so rapidly, things are changing so rapidly, that the more that we can create that transparency, the better. We've had different calls with different PCAs to talk about, they've done listening sessions with their health centers where they can ask questions, but also they put out there why, some of the decisions are being made. We think about this with staff who've been furloughed. That transparency is very important to explain to them, why this decision was made, rather than just sort of putting someone in that position and then feeling as, did my workplace care about me? Like, they didn't even fully explain to me what occurred. So in order to have this culture of retention, if you want people to stay, you need to make sure that, you're engaged, you're consistent, you're positive, and you're transparent. It's not always going to be perfect. No one can do this perfectly, but we can at least make the best effort as possible and really look at each of our workers both as individually and then as a whole in the organization, and be flexible, listen, take in and understand, and offer empathy. So in speaking about culture, speaking about retention, and keeping in mind everything else that we talked about, everything that has to do with engagement, that has to do with how we present this, how we talk to each other, starts with leadership. And leadership is different than management. Anybody can be a leader. Managers are managers. Not all managers have leadership qualities, but a high-functioning manager really embraces that. Leaders are visionaries. They drive innovation and they guide change. Right now, a lot of change is happening very, very quickly. And again, I just want to emphasize, it's not necessarily someone who's in a management role that can show these leadership qualities, but managers do have a lot of power. They communicate regularly with their staff, or at least hopefully they do. It's very important to build trust with their staff. So being able to exemplify these leadership qualities is very important. They take risks and risks on behalf of their team. So again, going back and maybe acknowledging, some people in my team are burned out. How can we help them? How can we, help them increase some flexibility so that their work hours are a little bit different? Or if telehealth is what they prefer, how can we continue that into the future? And managers are crucial, as as it says in here. They have very specific goals, and they look at the systems, they look at the structures, they coordinate everything. But that sweet spot is sort of between management and leadership. It's where you're motivating your staff, you're explaining the vision, and you're bringing out the best in them. And I think it's, as managers and leaders, we can go into work and realize that, maybe someone's having a really bad day, but it's a much bigger thing than solely like this one small instance that occurred at, in the workplace, that we're facing these bigger struggles, that we can really be there to develop policies that are going to bring out the best in them. And as we move forward, to keep in mind, like, what works, what doesn't, and make sure to not just throw away everything. Sort of, the pandemic ends, that's it, we're good. Let's go back to how everything was done before. A manager who is also a leader is learning from all of this, taking it into account and seeing how we can move forward into the future in an innovative manner. At the same time, managers, leaders, you need to take care of yourself as well. It's very hard to be there for your staff, to support them, if you yourself are burned out. You're dealing with your own instances of facing stigma. You're dealing with, your family, your job, if people are also in school while they're working, whatever it may be, we're all dealing with a lot. So, it's creating a community that we can all be there for each other, but make sure that if you are burned out, that if you're struggling with this, you also feel empowered enough to speak up and be able to get the help that you need, because that's the best way to be able to help your staff. And once you do that and you create this trust, you create this safe space, people are much more willing to stay. Most people leave the workplace because of their managers. So this is a key area to ensure that we are retaining the best, we're retaining those mission-driven people that we want. And as I mentioned, mission-driven, our culture needs to be tied to our mission. We need to have a mission that is relevant to what we do, that's current, that inspires employees, that guides decisions, and allows for growth. When we think about our mission statements or our mission in general, many times we have to go back and we need to revisit it. If it's still accurate to what our values are, do our policies reflect that? Does it reflect the culture that we want to build? How do we work best within this culture that we're creating? Is there change that needs to take place? So it's never a bad thing to sort of go back, revisit, see if everything really aligns, because again, this is showing your workforce that, the principles that we're setting forth, the policies that we have, our values, the culture that we have in this place is all based on this mission that we have. Another thing that I also want to mention with mission is that health centers here, to serve the underserved. And we all are in helping professions. And it's very easy in those professions to get burned out. It's very easy to have other people sort of place you in that category of, the people you work with are those others. The people you work with are the stigmatized population. So it kind of trickles over to you. We're also going to do that to you. You're dealing with all these health disparities, all these barriers that you are consistently seeing on a day-to-day basis. So we work more than we should. We work incredibly hard. We want to fulfill our mission. We want to be there for everyone, but we need to learn when to take a step back. And part of a mission should be that not only are we going to care for everyone else, but we should also care for ourselves. In the same care that we provide, that any provider, any health center gives to their patients, that same support and just general empathy should also be provided to their workforce. So, a mission statement is a mission statement, but it's really a lot more than that when we think about it in this complex, this systemic complex. And obviously I keep saying that, but as I mentioned, I am a social worker. So for me, I think in that sort of systems perspective, and I think that is such an important way to look at everything. So words and actions matter. When any of this that we're putting into place, any of our policies, even simple interactions that we may have with people are very, very important. So as it says here, what you say and what you do matters. How you say it and the actions you take matter. So we can make a lot of promises, we can say a lot of things, but if we don't have something to back it up, it just seems empty. And especially being health centers, being in a world that we're serving underserved populations, that all of you are doing this amazing work, we want to make sure that our values and the actions that our organizations take, both externally and internally with the workforce, really reflect, once again, that mission that we have. But it also reflects what we say. And it, you know, again, it's part of that consistency, that trust that you build with your workforce. Now, also looking at this from a broader scale, again, going back to COVID, words are incredibly important. So when we speak about anything, but especially in regards to health disparities, to COVID, to really not play into that concept of stigma and get trapped in that, we really want to use people-centric language. So rather than talking about these are, you know, COVID victims or they're spreading COVID, saying, you know, this is someone who tested positive for COVID. You know, that positivity and that way of talking about things is very, very important because it helps people to understand that, okay, someone may have a virus, but that's not who they are. So we want to separate the person, and we don't want to label people and sort of then put that extra stigma on their back. And this goes the same with the people who are in our workforce. So both the way that we utilize language with them and the way that they utilize language with their patients. So there's a lot more that I can say about this. I don't sort of want to go down a rabbit hole of language, but it's just really important that in all aspects of what we do is to try to use, you know, people-centric language, because it takes away that connotation of negativity. It takes away that stigma. And when people hear it, sometimes it's just sort of natural, and we want to make sure that it's not used easily throughout the workforce, or that people in the workforce don't feel that other people are sort of putting so much on them, that, you know, they're labeling them in many different ways simply because they are working with individuals who may test positive for COVID. And then just in general, as humans, just sort of that general kindness of how we talk to each other, the language that we use. And so just keep that in mind. I'll move on from this slide, but I just think it's so important that, you know, we look at the way that we speak and that we really think about it. We all have a normal, and we all have this idea of what's normal, but just because that's our idea doesn't mean that that is everyone's normal. So just be conscious of that as we talk about it. You want to take a strengths-based perspective. That is really important. Again, it goes to that idea of let's focus on the wins. Things are hard enough that telling people you are resilient. The work that you do just shows the strength that you have. You know, it's amazing. You come here every day, you support people, you save their lives. You know, we talk about our providers being heroes, being able to maintain that language, but also not just the providers, once again, everybody, all of the workforce, everybody in the staff, you know, they're all there and they're working the best that they can. So we want to make sure that rather than sort of beating them down with the language that we use, because it's very easy when things are tough, to talk about it in as positive way as we can, in a very, very strong way that we say, this is about strength, this is about your strength, this is about your resiliency, and that's why that matters. And then again, practicing that two-way communication. There's many ways to do that. So listening sessions, I had mentioned how some PCAs were conducting these, and you know, you're able to get great feedback, but you also want it to be, you know, leaders speaking to their staff and their staff speaking to the leaders. Being able to do day interviews, those are crucial. You know, why is the retention working, or why is it not? Why do people want to stay, or why do they want to go? Collect that data, collect that information. And as you do it, you know, think about these other components of, you know, is somebody leaving because of the language we're using? Is somebody leaving because of the structures that we put into place? somebody leaving because they don't feel comfortable enough talking about the burnout that they're feeling because they know that they're going to be stigmatized. Go a little bit deeper and really look at what those reasons are, or why things are working great in the way that they are and how we can continue that. And then recognition. Everybody likes to be recognized. That can be formal or informal, but it's really just saying a thank you. It's letting people know that, you know, we need them and they're important, and what they do is important to us. They're important to the grander scale of not just the health center, but their community and really society right now in regards to the pandemic that we are living through. And then I'm just going to sort of start to wrap up here. The reason I also wanted to point out the tested recruitment and retention strategies is because, as I mentioned, we're doing a lot of things that we may not have done before. So one of them, for example, is like the sudden, you know, change into telehealth very quickly. You know, the infrastructure for some may have been there and may not have been there for others. But there's so many new things that we're doing in this COVID era. There's so many new things that we're trying. So take the moment to really plan it out. Look at the implementation. Look at the data. Collect that. Now, it's not going to be like a sort of preset plan, do, study, act approach, because that really means that, you know, we had some time to plan. That wasn't really the case. But don't lose all this data that we're collecting. Don't lose all this information that is going to be very valuable in the future. And not just within your health centers, but also, you know, what the PCAs are hearing. What is going on in your communities? What we're seeing nationwide, worldwide, what are the different sort of methods that people are using in the workplace? How are, you know, maybe it's not a healthcare organization, but another organization was, you know, had wonderful success with implementing more flexibility for telework for those that could. Whatever it may be, start really keeping that kind of in your back pocket so that things don't go back to what they were, or you go back to what worked and you change what didn't. And here at the STAR Center, ACU, we have this, it's sort of an implementation strategy. So you can ask these different questions. This is definitely much more formal. As I said, when you're working under a crisis, that formal process is not always there, but don't negate this. Ask these questions. And again, just collect the data. So number 6, collected. And if you can, reevaluate it, test it again. That may be a chance that we may have, but don't just sort of let this go through because we're in crisis mode, and it's much harder to sort of take those moments to step back and think about it, because there's a lot of valuable information as we look at how to help our workforce that is there for us. So as I wrap up, workforce is our fuel. A health center with a full tank identifies workforce as an essential organizational issue, but we have to look at it through many different complex lenses to really understand why is our workforce struggling, because it's not always solely just the policies of the health center, but it's these grander societal issues that may be taking place. And we want to acknowledge that, and we want to support our workforce. We have resources that hopefully could help you. So I just want to point out too, we have our recruitment, retention and recruitment plan, which is our most popular resource. We also have a burnout assessment tool. So it only takes about 5 to 10 minutes to complete. It's 7 questions. And I want to do like a special shout out to our online courses. And all of these on this PowerPoint, you'll have access to when it's posted on the STAR Center. And these are all hyperlinks, so you can go there. And all the resources are free for use. The online courses, just so you know, you do have to sign up, but everything is free. So does anybody have any questions? Yes, Lauren. The slide with the testing question. Is this the one? I got, okay. I got a question, sorry, I realized that it was sent to all panelists from Lauren, who said that at the end, could you go back to the slide with the testing question? So here they are. And you can access these slides, or you could just email me as well. My email is just mfernandez@clinicians.org. It's also in the PowerPoint, and I'm more than happy to give you access to this. And then I do want to do one final thing. If we don't have any other questions, or if anybody wants to be unmuted to talk, please feel free. I do want to show what we have coming up next. And Lauren, once I do this, I'll go back to that slide in case you need to see it again. So for the STAR Center, we have a few things coming up. We have our High Functioning Managers Learning Collaborative. We're really excited for this, so please register if you are a manager. We have our recruitment boot camp. You can learn more by signing up for our newsletter, going on our Twitter. You should do that anyways, because Mariah puts together a newsletter and it's awesome. And then we also have our virtual conference coming up. Sabrina has done an amazing job at this. So, please go ahead and register. We're here to really be the place for you when it comes to workforce and when it comes to retention. So thank you so much. I really, really appreciate it. This was my first presentation at ACU, so I was really nervous, but you guys were all just absolutely awesome. And if anybody has any other questions, I'll be on till the top of the hour. And if not, be able to give you back, like a minute and a half to your day. Oh, thank you, Rosie. Okay, well, thank you so much, everyone. And please remember, I meant to mention this as well, please remember to complete our survey. That would really, really, truly help us. But from the team and for everyone, I just wanted to say thank you and goodbye.